Namaste to all. It's my privilege to warmly welcome all those who have joined from around the world uh, for the shift two on the day one of the seminar sessions on holistic value-based uh, counseling. On day one, the focus will be on SWOT analysis of youth and counseling models. On day two, we will deliberate on the vision of holistic value-based counseling. And on day three, the sessions will be address the implementation aspect of holistic value-based counseling. Now, let me take this opportunity to formally introduce our esteemed speaker, Professor Dr. Manishi Mishra. Professor Manishi Mishra is presently the core member of the Value Education Cell at Ajay Kumar Garg Engineering College, Ghaziabad, India. She has over 26 years of teaching and research experience in higher education. She is a resource person for the AICT and AKTU organized workshops on universal human values. With her doctorate from Regional Institute of Education in Education, she conducts faculty development program on instructional design, students in professional communication and soft skills. She has also served as the head of the Department of Education for 5 years, shaping teacher training programs. Dr. Mishra actively worked for the educational reform initiatives, including a collaborative project with ICICI Bank and the government of Rajasthan. Namaste, Professor, and warm welcome to this session. Namaste.
Thank you, Dipesh. Thank you so much.
Now, regarding, thank you, ma'am.
Anything else that you would like to add?
Yeah, now regarding the session, let me add few more things about the session. The total duration of today's session is 1 hour and 30 minutes, of which 1 hour will be devoted to the delivery of the content, followed by 30 minutes for interaction and concluding remarks. Participants are encouraged to post their questions in the chat, or also they can raise their hands during the session so that mic can be provided and the source person can answer to you. So with gratitude, let us warmly welcome Professor Dr. Manishi Mishra to commence today's session. Over to you, Dr. Manishi Mishra.
Thank you, Dipesh. Thank you so much. So, as you have introduced, so today we are going to propose an approach to counseling, an approach which is value-based, an approach which is holistic. So an approach which is holistic and value-based to empower the youth to unlock their full human potential. Actually, if I ask, is there anyone whom you know who has been struggling emotionally, academically, direction-wise? What do you think? I feel like everybody from us might be knowing someone, young person, who has been struggling with himself in terms of stress, frustration, depression. Or might be we might ourselves would have been one such young person. So counseling, if we see, has become a beacon of understanding and a support. So today we are talking about the SWOT analysis of youth and the current counseling models. As Dipesh ji has already mentioned, in part 2, we are going to discuss vision for holistic value-based counseling on day 2. And on day 3, the next day, implementation of this universal human value-based counseling model will be discussed. So as I said, today we are going to do this SWOT analysis of the present youth state as well as the counseling models. This analysis actually integrates the state of the youth, we can say the requirement, they are on the demand side, with the current capacity and limitations of the therapeutic interventions or the therapeutic practices which are prevailing. So that you can think of supply side, making a compelling case for fundamental change, because this would make us feel the need that we need a shift uh, in this the present counseling models. So what we propose is, just a minute, there is some issue and I'm not able to move my slide. Yes. Is it visible, Bhaiya? Dipesh Bhaiya?
Yes, yes. It's perfectly visible.
Okay, okay. So introducing this new approach, uh, what we see around globally, the youth population is pretty high. And not just in terms of population, they are pretty talented and techno savvy as well. So in this way, we see that there is an immense potential with us in the form of youth. But on one hand, where there is immense potential, on the other, we find simultaneously a catastrophic state of crisis also. If we see the cause of adolescent death today, how this catastrophic state of crisis is seen, if we see the causes of adolescent death, we'll find that suicide ranks top among all the causes which compels the youth to go opting for suicide. And we have listed many contributory factors like mental health disorders, academic and career pressures, family problems, adverse childhood experiences, social isolation, bullying at the school or in the society. Some of the societal factors also, which result into racial disparity, discrimination, etc. Besides, substance use is also one of the major contributory factors nowadays. But the question that we all need to think on, are these due to different causes or do they have a single root cause? What do you think? Are these due to what we see as contributory factors? They might seem to be number of different causes, but exactly if we see that root cause of all the mental anguish or the distress in the youth is just due to lack of right understanding about the reality. What reality that the youth is lacking or any individual is lacking is a reality about the human being, oneself as a human being. That we can say that as a human being, self consciousness and the coexistence of body, which is material. The simple reality, if one is not aware, it leads to a lot of problems and chaos within the self. Besides this, the human being, the environment in which the human being is again one of the reality which one lacks if one is not clear about his own being. So if we see the environment human being embedded in is the family, society, nature, and existence. And one more reality which one misses in terms of understanding the uh, reality of his being and then true purpose of his being as human being. So these three realities are pretty crucial for one to know, to understand. Because without understanding these realities, if we work on the superficial or the surface causes, we are working on them, but it may bring about temporary change. But for lasting sustainable impact, we need to work on the root cause. And that root cause is the lack of right understanding about himself as self consciousness and body material, which the human being is constituted of, the environment of which the human being is part, that is, the family, society, nature, and existence, and his true purpose as a human being. So it is important that we work on this root cause. So, holistic value based counseling, if we see, it is a necessary framework for ensuring harmony at all levels. If we see the levels where human being lives is the self, the body, the environment, which constitutes of the family, society, nature, and existence, through right understanding. And if one has this right understanding, what is the impact of it? If we see the impact brings inner transformation. Inner transformation brings about awareness of one's true purpose. When we are aware of our true purpose, and with this inner transformation, the consequence of this inner transformation is resolution of problems. When we are able to see this reality, the consequence is naturally that we are able to see how to come out of the issues that we got trapped into. Then, fulfillment of aspiration, because the human being is aspiration centric. So, when we recognize our aspiration, the purpose of our being as human being, we are able to find way out how to fulfill this aspiration. And this transformation of unfulfilled youth, transform him from source of problem to asset for the society. So the one who was so unfulfilled youth becomes or transformed to happy and fulfilled youth, naturally resulting into the which the person who was source of problem for himself becomes the asset for himself as well as the society. So this is what we propose. And now doing the SWOT analysis, if we see the strength, we can see the strength highlights the tremendous capacity. So by going by the demographic and potential, we can see that globally 16% of population is in the age group of 15 to 24 years by 2025 as per the UN data, which constitutes 1.2 billion youth. And if we see the Indian statistics, we can find that it has about 65% of its people under the age of 35. And the median age in India is 28.8 years, almost 29 years by 2025, as per the latest United Nations data. So we can see that we have the largest adolescent population in the world, means 253 million, where every fifth person is between 10 to 19 years old. And this demographic holds tremendous potential, tremendous energy. Besides, if we focus on the strength, there's one very important innate faculty, the capacity for correction, which is there in every individual. So every individual possesses an inner voice, the natural acceptance that we call it, an absolute, unchanging inner divinity that always favors relationship, harmony, and coexistence. So, whenever an individual asks himself what is naturally acceptable, relationship or opposition, automatically this inner voice, this inner divinity always favors relationship. And if we ask harmony or disharmony, this inner voice chooses harmony. This we all can explore within. So, this is strength which is there in every individual. Besides, the early intervention window is another strength that we have. We can see that about half of all mental health conditions manifest by age 18, establishing the youth years as the most leverageable period for prevention and recovery. So, if we recognize this, this is the phase, this is the period which can be benefited for the period of prevention and recovery if rightly address the root cause. One more precious and important strength that we can see that earlier it was pretty a taboo talking about mental health, but we can see there is increasing openness now to talk about mental health in many countries of the world, even in India. So, though there is no much statistic, but we can see that it has now decreased. People are now coming forward with their mental issues, talking it to the doctors or the concerned person. We can find that more than half, 55% of US adolescents reported discussing their mental and emotional health care with a healthcare professional, which is very good. Because if we recognize such kind of a problem with us, we need to openly talk to it. Besides, uh, this is very true that the need is evident and it is already being addressed by several existing counseling therapies that are currently in use. To name some of them as psychodynamic therapy, cognitive behavioral therapy, rational emotive therapy, mindfulness based therapy, creative therapy, and many more to name. So, this is our strength that we already have a established structure, structural efficacy. So, besides strength, we also see not many weaknesses because the greatest challenges stem from these weaknesses only. And we have limitations of conventional therapy. So, let us see what these weaknesses are. One of them is lack of clarity of oneself as a human being, not able to understand or see this reality that human being as coexistence of the self, which is consciousness, and the body material, resulting into assuming oneself to be the body. When we assume ourselves to be the body and work on fulfilling the need of consciousness, which is continuous, then naturally it leads to instability. So we get focused to body while the issue is with the self or the consciousness. Lack of holistic humane world vision also manifests in myriad ways. When we don't have this clarity about ourselves, we also lack holistic humane world vision. And this results into lack of clarity of the true purpose in life and one's full potential as a human being. Lack of understanding of human relationships. When we don't understand ourselves, we are not able to understand the other as well. And when we don't understand the other, it becomes difficult to have mutually fulfilling relationships. So, lack of right understanding about human relationship is again an issue that leads to many problems and stress within. Then the third thing that gets manifested as lack of clarity about the need and purpose of physical facility. So when we don't understand how much do we need and why do we need these physical facilities, so mistaking the qualitative need of the self for continuous happiness with the quantitative need of the body for physical facility. And this confusion, considering ourselves as body, leads to so many issues which we all can see we ourselves are facing and see the youth is trapped into, because this need of happiness is now getting fulfilled through physical facilities because we assume ourselves only as a body. Besides, a major weakness that is statistically recognized is aimlessness of the youth. The youth lacking understanding often are purposeless, they are aimless. And if we see the demographic, the estimated number of youth aged 15 to 24 is not in employment, not in education or training. That is need. And this is globally. And if we go by the data, 262 million by year 2025 means one in every four young people is need. So, not in employment, nor in education, and nor in training. We can think of such a youth who is, aimless, purposeless, not doing anything. And if we go by the data of women, they are twice as likely as young men to be neat. Rate is higher in low income countries. Even we can go by Indian data, we can find it. We can find it more than even this. So this is again a weakness that is a major concern for all of us. Besides, there is a high mental health burden. One in seven adolescents between 10 to 19 years lives with a mental disorder, and that too across the globe. As per meta analysis, 50% prevalence of depression among undergraduate medical students in India is reported. Think of a medical professional who himself is in depression and don't feel like living, and such doctor treating the other person. How will it result? Besides, systemic gaps too are too much. The global median number of mental health workers is only 13 per 100,000, with severe workforce gaps, particularly in low and middle income countries. So there is a global call for, having mental health workers, because there are more such cases while the uh, requirement is more, but supply is pretty less. This is again a problem in major terms as a weakness of the present system. It is felt that youth even evaluate himself based on external or ever changing factors. The factors which are changing, like body characteristics, which is body is young, then youth, then adult, then elderly. And in this way, we find that body characteristics continuously change. But if an individual evaluates himself on the basis of body characteristics, naturally he gets trapped into a kind of frustration, because this is ever changing. You cannot stop your age or the appearance of your body. One more factor on which the youth evaluate themselves is accumulation of physical facility. which leads to instability. Because when we go on buying or accumulating physical facility, today we buy a car, today we buy a mobile, and very soon it becomes obsolete. And the person who has associated this physical facility with respect then wants more, needs more, and goes on accumulating more and more, which again leads to instability. So, this external reference is again a big problem and a weakness. Besides model limitations, is again a weakness. It is proposed that traditional CBT and other current models focus largely on symptom or behavior change, may lack clarity of the root cause, and risk the superficial change. They may fail to address the misunderstanding of reality due to lack of right understanding. So, this again is a limitation to working if we work only for superficial or symptom or behavior correction without the clarity of the root cause. So, change may be seen, it may bring about some change, but because of the lack of understanding of root cause, these this might risk the superficial changes. So these are the weaknesses so far. So if we see, we have so far discussed about the strengths and the weaknesses of the present state of the youth, as well as the counseling models or the therapeutic interventions which are there. So based on this discussion, if anybody has any question, observation, or sharing, then we would like to listen from you. And you can type the question in the chat box, or you can raise your hand, unmute, and ask your question or share your observation.
Mm, Ma'am, there is a question in the chat, like how to a female adult who is having a suicidal thoughts due to academics, lack of interest in earning or in any employment involvement. Yeah, there is a question like that. Would you like to take that?
Yeah, yeah. See, the problem here is if we see that we associate ourselves, our happiness, not with our own self, rather we associate it with the performance uh, in our results in academics. The problem is not with the academic failure, but problem is that we don't, refer to ourselves that it is me who need to be happy. It is me who need to be ensure continuity of happiness. And my happiness is my responsibility. It is not dependent on academic failure. Because in a system, if we see if one candidate appears in the examination, passes the examination, but feels empty. On the other hand, another candidate, he gets into the examination but fails, he feels worthless. So it's, worth to observe that the same system but two different results. But if we see, the suffering is same. Both are suffering. But why? This suffering is not due to the outcome of their exam or the result, but suffering is due to associating our self worth with the marks or the result. So, this is the main cause for which we feel frustrated. So, we can just draw the attention of that innate faculty within, that uh, natural acceptance. What exactly do we aspire for? What is our aspiration? What is the purpose of being? So once the individual is able to tap that inner, inner potential, inner divinity, so we can see that we can relate to that inner potential and become comfortable immediately. So, since it is important that we, uh, make them relate to themselves rather than those external achievements. And this is the main cause of the pain and the suffering. Ji.
Right.
I hope this answers the
Uh,
question, or anything else that you would like to know.
yeah. Yeah. And there is another question, like how do we differentiate between surface symptoms and the root cause? You mentioned lack of right understanding.
Ji, ji. See, the surface systems, if we see, they can be manifested in the form of stress, anxiety, restlessness. But then, if we see the root cause of all these symptoms that are being seen, it is in the thoughts what we have assumed to be true. So, if we don't have the clarity about the what the feelings that we have, which create our thoughts and behavior and work, if we are not aware of those feelings, what exactly is right for me, what do exactly I aspire for, if I don't have that clarity about my own feelings, about my own innate divinity, my natural acceptance, then I get trapped into those superficial symptoms which are externally, getting influenced. So when I'm working on the basis of, or I'm functioning on the basis of influence and the pressure from outside, so if even if I try to work on these superficial symptoms of the problems, I don't get, permanent solution to those symptoms. Rather, we need to work on the root cause, which is innate in me in the form of natural acceptance. From there, I can recognize the problem and accordingly identifying my feelings that form my thoughts, behavior, and work. Ji. Amal ji. So, any other question or observation from anybody on this discussion? You can share your observation also on the strengths and the weaknesses of the present youth as well as the counseling models that we have been talking about.
Yes, thank you, ma'am. If any of our participants have any more questions, they can raise the hand so that mic can be provided. Else they can write it in the chat also so that uh, ma'am can answer it. I think we can go ahead, ma'am.
Ji, ji.
I have a question. Can I ask?
Yes, please
Yes,
go ahead.
yes, Ilaj.
Do we have any examples that we have, where there is a problem and then we was solved due to this model? Do we have such examples? I mean, even one example, if you can.
See, practically based on universal human values based counseling model, it is in the process of development. So right now we don't have that particular example to state that we have implemented this and we got these results. But yes, in the experimentation in this process, We are conducting a morning session, which I'm going to talk about in the next, when we talk of opportunity. So we are conducting a morning session, which is a program of self-inquiry. So based on this, when a person is able to tap his inner, conscience, inner divinity, and starts working on himself, recognizing the reality of himself as a human being, this changes in the behavior which were superficial earlier. Now they start changing from within. When it starts changing from within, it naturally brings about harmony in the thoughts, from feelings to thoughts, and these harmonious thoughts result into harmonious behavior and work. So this is how we are in the process of developing module, this model of counseling. Ji.
Today in the sharing, when we heard the Bhutan Institute, they are also using similar model, right?
Ji, ji.
Nice.
They are using the model. They have started, experimenting it,
Yeah,
and
yeah. Found,
especially for the drug abuse.
yeah, yeah. And they found the differences also. Yeah, yeah, I know.
Yes.
Okay, thank you.
Yeah, thank you, Dr. Iladidi, for that questions. And Manishi ma'am. So
Yes.
I think we continue with the session.
We can move further now.
Yeah,
Okay.
please.
Let me see again. My slide has got stuck. Yeah. So where there are strengths and weaknesses, but then we have opportunities also for value-based transformation and its scalability. So opportunities exist in, leveraging the innate mechanism that I'm talking about again and again for transformation and modern scalable delivery methods. Proactive integration. So it is like UHV courses, which are aspiration centric. We integrate them into education. The proactive framework, it provides a proactive framework for self development before concerns or crises arise. And for this, the morning session that I was just talking about, this morning session is an example of an effective online self inquiry program that is already in place and active since more than 5 years without a break of a single day. So we run this a session of 4 months back to back, and people, those who are attending it, getting into the this process of self-inquiry, getting into the process of what exactly goes on within, and how can I ensure that harmony which I am aspiring for, understanding one's thoughts, feelings, and natural acceptance. When one gets guided by the natural acceptance, this innate divinity, which is a silent witness. So when we start inquiring it, it guides us uh, naturally in favor of harmony, a relationship, and coexistence. And this results into the harmony of thought, into the behavior, and we become comfortable, howsoever is the chaotic condition outside. So this is one of the opportunity for all of us, which one can join and get into this process of understanding one's real being, real truth. Then we have the self-referential correction, understanding that every child or every youth wants to be good and do good, shifting our focus from the problems in the youth to this innate divinity and potential in every individual and addressing those. So nobody wants to, do something which is unethical, something which is not considered right. We all want to do good. We all want to be good. But the problem is, for doing this good, where is our focus? Focus on outside, or focus is in the innate divinity and potential that we have? Once we understand this and start addressing this innate divinity, the results will be seen very positive. So, counseling can provide proposals that can be verified by the youth internally on the basis of their innate natural acceptance, enabling them to then validate these proposals experientially on the basis of their behavior and work and move towards definite conduct. Because if we see this natural acceptance, we uh, get the answers which are always definite, which never change. So this, if we get guided by this innate divinity, naturally the conduct will be definite, which we all aspire for. Besides, there is an opportunity for deepening the existing models. This human value uh, courses, this UHV courses, when holistic value based counseling framework can be used by itself or to enhance CBT and other existing therapy models by introducing value checks. By promoting clarity of understanding, it can restore meaning and purpose in the life of youth. So, these are the opportunities that we have so that we can bring about the holistic value based counseling model. While we have opportunity, we have concern of threats as well, crisis level suffering, the systemic failure, the consequences of failing to implement a fundamental scalable solution are severe and visible. There is reported life threatening crisis globally, but as per the statistics of 2025 by WHO, more than 720,000 people die due to suicide every year. And suicide is the third leading cause of death among 15 to 29-year-olds. We can also see that 73% of global suicides occur in low and middle income countries. And for every suicide, there are many more people who attempt suicide. See, some are committing, and more than that, are thinking of committing suicide. And a prior suicide attempt is an important risk factor for suicide in the general population. In India, we see suicide has been the top cause of death in 15 to 29-year age group. Means 1 in 6 deaths in 15 to 29-year age group in India is just due to suicide. Think of the youth, this immense potential. We see just so much of wastage if we just keep on seeing this suicide rate rising up. It's our potential. It's the the strong foundation of the future. This is getting wasted just because of lack of right understanding. Even uh, the 2023 report of National Crime Records, 13,892 students died by suicide last year, which is highest in decades. Where are we going? What's the state? It's a big threat. Hmm? Besides this suicidal threat, we have stress related illness, which cause again another kind of a threat. Center for Disease Control and Prevention of the United States, CDC, stress accounts for 75% of all doctors' visits. According to Occupational Health and Safety News and the National Council, just a minute, National Council of Compensation of Insurance, it says up to 90% of all visits to primary care physicians are for stress related complaints, contributing to ailments like high blood pressure, heart disease, ulcers, and migraines. It is proposed here that this stress for which a large number of youth is suffering is internal, which is arising from disharmony or contradiction within the self. So this is one of the major threats just because of the lack of right understanding about the human being as coexistence of self and body. And this self is, that aspires for happiness, wants to ensure continuity of happiness. And we are missing this self, this consciousness, and that's why this not able to address this contradiction or disharmony within the self. Other than this, there are societal drivers which have led to breakdown of traditional support systems like breaking of joint families. This may be a major cause of isolation and unhappiness in the youth or the young adults. Because earlier we had such a strong family system where at least there were 6 to 10 members. So, whenever in isolation or any kind of worry or concern, the child used to talk to his elders or the family members and resolve the issue. But nowadays, in this nuclear family system, where both parents are working, the child feels so isolated because there is no one to talk to. If he has any concern, issues, worries, he has no one to share with. So this is one of the societal driver that has led to this kind of a situation. Besides, societal assumption about money or success, etc., may also foster cutthroat competition and stress because we assume that money is everything. It leads to one goal, that is accumulation of more and more money. And in this race, when one gets involved into, it leads to so much of stress, anxiety, so many diseases which are actually stress related and not body related. They are simply an expression of what all is going on in the self, the consciousness. Inadequate reach is again a threat that with only 13 mental health workers per 100,000 people requiring help, particularly in the low and middle income countries. So if we see the counseling currently reaches only the tip of the iceberg, 13 mental health workers for 100,000 people. Think of it. It's simply an iceberg which we are touching. And we cannot afford to wait for the calamity to strike again and again. The unfulfilled human being is a source of problem for not only itself, but also for the family, society, and nature. So these are the threats. Now, we have again gone through the opportunities that we have right now with us, which we can encash, leverage the innate mechanism for transformation and modern scalable delivery methods. And on the other hand, we have threats like life-threatening crisis, stress-related, social societal drivers, which has resulted into breakdown of traditional support systems, inadequate reach. These are the so far threats that are issue of concern for all of us. So before we sum up, maybe have any kind of observation if you have to share, any reflections that you have to share, or any questions that you would like to discuss, we can share it.
I would like to just share that in school education,
Ji,
at least most of the regions in India have made a a counselor compulsory in every school. Of course, it's proportionate, one or two or whatever the school can also afford and
ji,
what is the requirement. But yet, as you rightly mentioned, the challenges have increased as far as depression and non-communication to their with their parents. Even today's panel discussion and education, the two youth students who were there, even they said the same thing, that they're not able to communicate with their own friends, with their own parents. So all this is increasing, which definitely means that the traditional counseling practices which have been going on definitely need to be looked into, and this new model that you're proposing definitely I think would work out better also, especially as you're based on the morning sessions and the number of people who have themselves experienced the transformations within them. So thank you for your presentation.
thank you, Leslie. It's very true because of the present scenario. If we see if a school or the college has 500 students and just one counselor, and nobody is able to, how many number of students would be able to reach to the counselor? So suffering is more, requirement demand side is more, but supply side is less. This is a major threat. But yes, important is to empower the individual, which can be done by adding these courses of universal human values in the course curriculum. And nowadays, if we see that youth is technically so sound and connected, with each other through this technology, and this can be a major source with which we can reach the masses and help them. Like I remember in the COVID time, uh, it was the advent of COVID that created a need of this online session, which has made us it has increased our reach with masses. So, in the same way, if we can add these courses, universal human value courses, and for the students, because they are based on self inquiry, they are universal, they are rational, they are verifiable. So, if the individual is able to get into the process of this self inquiry, this will make him more confident and empowered. So, rather than thinking of coming out more and more appointment of counselors, it is we can provide them this counseling through self inquiry when the person can get the answers from within and working on the solution, rather getting resolved and thinking of solution centric approach.
Very true.
Manisha ma'am, may I just
Please,
raise
please
the
go ahead.
point? Yes, yes. So I was just going through one last query that we got: how to motivate a female adult of 22 years having
Ji,
suicidal thoughts. So,
ji.
ma'am, how can we project the holistic vision-based counseling as far as high-risk cases are concerned, like extreme depression, suicide cases, and extreme substance abuse? So what is or where does the role of HPC lie in such cases? Is it a
See,
replacement?
if the case is pretty critical, then we need to have help and support from clinical counseling, or
Yes.
if medication is required, we need to identify the state of the individual. So once if medicine is reach to such case, and along with medication, we can go for this kind of counseling. Then it will help, because if that mental issue has aggravated so much that it has started impacting the body, so we need to address that bodily issue as well. So we would like prefer to seek help from a psychologist or a clinical counselor who can first address the medication part, and then we can move on for universal human value based counseling model also.
Right, ma'am. Something like, ma'am, we address the disharmony that occurred in our body. So once we are able to see that, we must take the right approach to restore the health of the body. Correct, ma'am?
True.
Is that what? Yes, yes.
Yeah, true.
Yeah.
Because right now, if we see what happening is, one student gets into depression, goes to the doctor, doctor provides the medicine. What do we think? The medicine works on the self or the body?
It should work on the body.
The medicine works on the body.
Yes.
Body gradually gets into relax. But what about the self? The self, which is not able to find solution to the problems and the concerns that one is trapped into, if there is no guidance over there, neither guidance from outside, and because he is not aware of himself, he cannot take guidance from that inner divinity. So he is so helpless. And after a certain point of time, even the medicines stop working on the body, or they have some adverse effects. So it is important that we address both at the level of the body as well as at the level of self.
So, ma'am, when you were talking about this, I was thinking about an alternate scenario. Like, what if the a person in question is not addressing? He or she might be having these tendencies and they are not speaking out. They do not want to visit a counselor. Even if people around them are advising them to go and see the counselor, they are moving away. So, how do we bring the attention of such cases? How do we make sure that they seek that help?
Yeah, it's challenging
That's
actually.
very challenging.
Yeah, very true. It's challenging when the individual is not able to see that he is in trouble or she is in trouble, and what's the solution and how can the individual can get it over. So in
Yes,
that case, uh, first of all, how much comfortable we are within, that would play a major role, because sometimes it happens. On the one hand, the child is so disturbed and a violent condition, and seeing him, we also get influenced and start scolding, abusing, or beating. This is how it happens because we also don't have the solution. So first
yes,
of all, we have to work on ourselves, understand the reality of ourselves as a human being. And then with this understanding, when we understand the other, we can also see why is he suffering. What are the root cause? What has made him so, you know, in such a pathetic condition?
yes,
So, with the feeling of relationship, understanding him as a sufferer and helping him, we can talk to him, remind him. We can talking doesn't mean that making him understand. We start convincing that we are right, we know, we understand, so you should follow us. But then rather putting the things before him as proposals so
yes,
that he get an opportunity to see within, explore within, and then see what is right for him and what is not. But when we say that, yes, you are ill and you are not mentally okay, you need to go to the counselor, you need to go to
right,
the psychiatrist, and this is the only solution, then nobody accepts because the inner divinity, we
yes,
know what is right, what is not. Even if we are not referring to it, it is silent, but we know this. So we don't accept that there is something wrong with us because
Yes.
we are, witnessing from that place, from that inner divinity. So that's why we don't accept that we are ill.
Yes.
So the thing is that how we affectionately, with the feeling of relationship, deal
Yes.
with the individual, making him see through himself and
Yeah.
understand his state.
Yes.
And
Yes.
once if the sufferer is comfortable with you, assured with you, he himself or herself will ask you that I need solution. I want to come out of it. Please help.
Yes. Yes. So we also have to see the role of the immediate caregiver around these people, the immediate family member or friends who are associated with people, and try to bring them uh, in a condition of relationship, rather than,
Ji, ji,
as you said, ma'am, making them in a situation of opposition regarding their own condition. Right.
ji.
Yes, ma'am. It is very well put, ma'am. Thank you. Thank you, ma'am.
Thank you, Melji, for
Any
that
other
question.
question? Dipesh Bhaiya, I'm
Yeah,
not able to see the timing or any hand
it's
raised or question
okay.
in the chat.
Uh, yeah,
So you'll
actually, it
have
is.
to take care of it.
Yes, yes, I will help you on that. We have about 10 minutes remaining to conclude this session. There is not much hand raise or any not much messages in the chat. Also, I would request any of the participants who would like to put forth any reflection or any questions you can put across. Uh, you can raise your hand or you can write it in the chat also. That would be also fine. Uh, so feel free to ask questions is what I would say. And one question from my side to Manishi ji is that one point which I was really alarming the numbers, like the suicide, the largest cause of, or in the case of adolescents. So that is really alarming. And
Yes.
another point which I was thinking about, especially in India, is about the breakdown of the family support system, uh, which is uh, uh, which is one of the major cause of the problems of uh, in the Indian
This
scenario. So
breakdown of family system is the cause of isolation and unhappiness in the child or in the individual.
yes,
Ji.
yes, that is actually alarming. And even I was thinking of taking the point which Ila Didi put forth about like the students saying that I'm not able to share my problems with my family member, the parents itself. So if that relationship itself is not kind of supportive to the child, then what else? Which other relationship would be, be supporting the child is what is a very alarming concern, which I was thinking. Do you have any comments on this?
Yeah, that's very right, Dipesh ji, that if a child is not able to talk to his parents, then who? And this is what is happening. When there is no one to listen to, the child finds ways through internet. You can find that students getting, more and more uh, getting friendly with the devices. They are seeking help from the friends who themselves are not in a good condition or not with good practices. So the child gets deviated to some mal habits, mal practices, and resulting into becoming more violent or getting into alcoholic or some such practices which is more harming towards uh, his body as well as mentally. So it's really alarming, but the solution, where lies the solution? If we see the solution, so then we'll have to go through the strength of the present systems, the strength that we have right now from which we can draw this opportunity and encash the opportunity. So if we see the strength, we have talked about the demographic that we have, innate capacity for correction that we have, and the conditions, if they get manifested by the age of 18, then the most leverageable period, there itself they can be tapped for prevention and recovery. The child who is open and shares his issue, we need to take into consideration, not leaving him unaddressed. So, besides the structural efficacy, but then the most important thing is opportunity that we have right now. That is the proactive integration of UHB courses into education. And this proactive framework for self development before this state where the child feels so helpless, even in the family. So, if it is addressed proactively, then I think we'll be able to save the child, save his future, save the family, save the society. So it is important that it gets addressed proactively. And that's why working on we feel the need for this kind of a counseling model, which is holistic, which is value based, which leads to harmony within and harmony outside as a result.
Yes, that's very true, Manishji. And also probably including in the education system also might definitely help, isn't it?
Ji, ji.
Yeah. Yes. Any other reflections or questions uh, any of our participants have? You can either put it in the chat or you can hand raise so that mic can be provided. We have some more time, almost like 15 minutes time is there. What I would uh, uh, thinking of adding is like considering the intensity of the problem and the vastness of the problem. There are a lot of points to be addressed, right? I mean, the policymakers has got the role, the education system has the role, the parental relationship and the teacher-student relationship has a role. The counselor has an even more greater role. So, which means like we are very behind what is what is expected. And actually, as mentioned by you, Manishji, it's only the tip of the iceberg. The large part of the problem is even unseen. And I was thinking about like how would be the scenario maybe the next 10 years down the line in the societal scenarios. It's alarming actually.
Yeah, if the present situation and the scenario, the threats and the weaknesses, they persist, then actually we see that 10 years down the line, it is really threatening, threatening condition.
Yes.
But while we have recognized it and we all are working for the solution, but the superficial solutions won't work. We need to have a solution which is sustainable, which is long
Yes.
lasting or everlasting. And that's why it makes us feel the need for a new approach to counseling.
May I interrupt, ma'am? Dipesh sir.
Yes, yes,
Please,
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 Amal.
Amal.
So yeah, in the day shift, in fact, there were many questions about how the focus from the mobile phones. So since our generation, the current youth that we are addressing, um, uh, they're really stuck with their phones. How do we take their attention from there? Because they don't even want to listen to our advice, listen to our words. Uh, they like to take the help of ChatGPT, but not from the real human person, maybe standing on their side. So how do we shift their focus from there? How can we really get them to learn value education because they don't give value to these value education courses? So
Mm.
this was one main concern everybody is having, even people who are taking the UHV courses and all. So, any of your inputs, ma'am? I mean, you have dealt with many students, you have touched the lives of students. So, how can we shift their mindset or maybe inspire them or motivate them to change their focal point from that physical facility to their um, right understanding?
See, what I have observed is that when we don't have anything constructive, we get into destructive. When we don't have any purpose and aimlessness, with this purposelessness, aimlessness, we want to draw happiness from some external sources. And this search for happiness from outside, because we are not finding it in our environment, form of relationship, or not getting satiated with physical facilities also, then we look for this happiness from the temporary sources. So this mobile phone is one such gadget which has come into every hand nowadays. So without having the clarity and the purpose, clarity of the purpose of this mobile phone, the child gets into a trap of what all has been designed to lure a youth into this small gadget, because he finds happiness there, and this momentary happiness doesn't suffice because he wants continuous happiness. So from one program to another program, and gradually the internet, the scrolling, and it completely takes his most of the time.
Mindless scrolling.
Mindless scrolling, you can say. And this child, when not having fulfilling relationship, so he don't feel assured with the family members or even with the friends. Then this child who is isolated gets himself comfortable with these gadgets and the content that is being designed in a manner that the child gets trapped into it. Recently, we had a case of our college where I was in my previous college, where a student got trapped into some kind of a gaming,
Mhm.
which was not a gaming but a gambling kind of a scene. So there, earlier when he invested money, he got some money back, and again he invested, he got more money back. This greed made him invest more. So he got money from his parents, from his friends, and he started investing.
Okay.
Then he kept going on in losses. And finally, this resulted into suicide. huh? So, somewhere it is not the child or the mobile who is responsible, it is the entire system, the family system, the societal system. All are responsible, the teachers, the parents. So, where exactly the root cause is, why all this is happening? So, we need to address this root cause. And the root cause is lack of understanding about ourselves as a human being. lack of understanding about our own environment and surrounding. What is my purpose? What is my role in this family or the society or nature? If I don't have this clarity, then I have that purposelessness. I don't have the purpose. Why am I? What for am I? What I have to do? How to do? So the child loses interest in everything. And now, when this, rather than waiting for this kind of a situation, that's why we are talking about the proactive integration, which is there in our hands. So rather than looking for the counselors, we can transform every individual as a self counselor.
Yes.
So one is when one is able to tap this innate faculty,
Mm.
the inner conscience, then if we are able to see that I am coexistence of self and body, it is
Mm.
the self who needs happiness, who is in stress, not the environment or the body. It is me. So I'll work for my own happiness by right means. That is having a fulfilling relationship, understanding my role and responsibility in the family, in the society. What do I need to do there? So, with this all clarity, when one feels resolved, one becomes more comfortable. So, actually, this is the time, it's a time for taking action, calling for an action of proactive integration. This is what I feel. Uh, and whatever the condition presently is, yes, we need to address it as well. But from where would we start? Would we start from the other or would we start from ourselves? So it is like we have need to start from ourselves rather than starting from the other.
Yes.
And for this, we have this morning session
Yes.
where hundreds of people across the nation joining this session and working on themselves for the harmony within so that they can have understand the family structure better, the societal structure and societal goal better, and ensure their participation, their aim, their purpose, and fulfill it.
Yes. Yes. Very nice. Very nice, man.
Very true. It's a very large task at hand,
Yes.
Yes,
what we are
yes,
trying to see.
Yes.
Yeah.
Especially when we see students who are going through issues. So, and we are trying to tell them that the human being is the coexistence of the self and the body. So, actually, the role of self is to take care of the self as well as the body. So, if the body is in trouble, the self has to realize that. The self has to realize the body is in trouble, take proper medication for that. At the same time, the self is also not healthy. So the self also needs to be taken care of. So it is a multi-dimensional approach that counseling actually needs, and that we're at different stages of mental health issues. Right, ma'am? Right, sir?
very right, very right. And this is what we are going to talk in next coming 2 days, while
Yeah.
we will be talking about the vision for holistic value-based counseling and its implementation.
Right,
Yeah.
ma'am. I think you may sum up, I guess.
Yeah.
Yes.
So, so far, what we have seen is that the global youth population representing immense potential, simultaneously experiencing a catastrophic crisis of mental health. Suicide ranks among the top causes of adolescent death, driven by the internal disharmony and stress. The proposed root cause is the lack of right understanding about the reality of the human being as self consciousness and the body material, of the interconnectedness of the human being with its environment. This interconnectedness with within the family, society, nature, and existence, and the purpose of human being. So current counseling models, if we see, they are largely focused on symptom or behavior modification or behavior correction. But this may risk superficial change and fail to address the lack of right understanding. So this is what we have discussed today in the very first session while doing this SWOT analysis of the state of the youth presently and the presently used counseling models. But tomorrow we will explore the vision of holistic value based counseling, which is centered on attaining harmony in the self through the development of right understanding and right feeling, and an inner transformation ensuring continuous fulfillment rather than a superficial change in symptom or behavior that may be unlikely to sustain. So, this is all for today's session. So, thank you
Ji.
everyone for
So,
my. Yes.
right. Thank you so much, ma'am, for that insightful session on SWOT analysis of youth and counseling models. It's deeply troubling that the suicide stands among one of the leading causes of death in adolescence. And what makes this reality even more distressing is that it is often stems not from external threats, but from the inner turmoil, the disharmony within, the stress, unresolved emotional struggles. So tomorrow we will explore the vision of holistic value-based counseling, which is centered on attaining harmony in the self. So please join at 12:15 a.m. IST to attend the session. Thank you so much to all the delegates, participants who have joined from around the globe to participate in the session as part of the 10th International Conference on Human Values in Higher Education. Thank you so much. We will close for the time now. Namaste. Namaste.
Thank you, Manishi ma'am. Thank you, Deepesh.
Namaste. Thank you,
Namaste.
everyone.